Hi, and welcome to Good News Friday. Hey, Mike Simon is here. I'm Joey Arbor. Welcome back, everybody. Thank you so much for making us a part of your day as we seek out news. And in the news, we're hearing that Medicaid, Medicare in 2024 are decreeing that funded programs from hospital perspective, you're getting money from these government agencies and you're a hospital, you must screen new patients for the social determinants of health. That is a requirement, specifically focusing in on food insecurity. Why food insecurity? Well, if you get in as to why some people are receiving medical treatment and help, many times what you'll find is they don't have a good diet. This is leading to all kinds of disparities in a health of a person. And so the government is wise on this. And they're like, you know what? Hey, these hospitals, what we really need from you right now is making sure if you have someone that is suffering in some way, is the reason behind that they just don't have food? Because that is huge. Food insecurity is big, and it causes health challenges many times. And Mike, here's what we think is going to happen from that. The hospitals are now going to have to start leaning in from the community partnerships that they have, that with these agencies that are hunger relief focused, hey, we need some help over here. We've had someone that come into the emergency room. We're fully aware of what they're really suffering from. They're starving to death. They're starving. And we need to get them some food. So can you help us out over here? They don't fit the criteria to be admitted into the hospital. That's a separate set of criteria right there to get a room. But they need help, and they need help now. Healthcare partner, meet food insecurity partner. We're working now. This is a community-type solution to solve some of the health challenges that we have in the United States. Mike, we here at Simon Solutions, we're all about that. And we provide the platform to do so.
Wow. Boy, that's interesting news.
Yeah.
Well, that's interesting from the fact that we have some hospitals that do partner with food banks. Yes, and they form these partnerships because they want to know who is food insecure. But now they determined that health disparities can happen through food insecurity.
You bet.
So it seems kind of natural that, you want to keep track of the people that are food insecure, the individuals, the families, and you want to have all the information you can about these people to be able to make an assessment about them.
Yeah.
You got to have data.
Yes.
And that's where we come into play. We'll give you the data about this. And so it makes sense that hospitals would partner with community partners and get this relevant data, and that'll give them a better way to increase their community health of the community. That's what it's for.
Yeah.
Wow. Boy, that is something else, Joey.
Well, the referral aspect within CharityTracker, there you go. That's how that a hospital can seamlessly get the information about a patient that they're currently working with to a food pantry, food bank, and then working from this perspective. Let's face it, the hospital may have medication, but they don't have food. When we think about how that we actually solve some of the challenges that someone has when they go to the emergency room, sometimes the health disparity that they currently have is based upon a compromise of their immune system. Why is that? They don't have a nutritionally sound diet. There's a lot of aspects of this, Mike, but I must say I'm very hopeful about where our government is seeing some of the challenges, but how that they can help with this and actually mandating from a hospital perspective. Hey, find out as to what is going on with the person that is in your emergency room. And why were they here last week as well? What we have here is a disparity that is food insecure focused. And if we can solve that issue, this person will now at least be able to have a good diet, get their immune system strengthened, get them to the form of life of which is healthy. And that, of course, requires a good diet. Many times, Mike, getting into the root, the issue that is at hand, that's really where we're able to start solving some of the issues. We got to find out what is really wrong. And when you look at what's happening, many times what we see as a symptom, right? This gets back into the health treatment in the first place. We're seeing a symptom, but we're not actually treating the problem. So from a hospital healthcare type facility perspective and them getting money from Medicare and Medicaid, that is going to be the new requirement. So the hospitals, we would just suggest this to you. If you're out there, your healthcare agency, and you know what we're talking about here from this mandate, hey, we here at CharityTracker can help you connect with your community partners. You know, the ones that we're talking about, the ones that when you refer a patient to that agency, they can help them with the food that they need. And here's another aspect of this, Mike, and let's dive into this. What if someone has diabetes, right? The healthcare information there from a diabetic type of diet that this hospital knows, all right, this patient, they have diabetes. They're going to need a specific diet. The nutritionist at the hospital, all hospitals have a nutritionist, So the nutritionist provides a formula, if you will, for the food pantry that they're referring to. Hey, this person that we're sending you here, they have diabetes. They're going to need this type of food. They're going to need this, not this, right? So now we're refining that referral. We're actually getting relevant and very important information to the food pantry about the specific needs of an individual. Getting into solving some of the challenges that we have in our community that are real. And sometimes, Mike, I think that they are growing. You've got all kinds of different disparities, but getting into the health type focus. This is where I think our government, Medicare and Medicaid, they're leaning in on this and they're understanding we got to bring in this partnership. Because how many times, Mike, we hear this? It's like, well, we didn't know that this agency over here could do this, or we didn't have a way of effectively communicating with them. Now you do. CharityTracker. We've got, Mike, here's the opportunity with the referral aspect of this, specifically focusing in on how do we hand off that process. It's not out there on Facebook. The referral information, if you will, is not compromised from exposing this person that is in the emergency room or in the hospital, to all this, potential views or awareness of their issues. But making sure that you have the referral that is to a relevant agency that is near you that can actually provide the next steps there from this perspective. This is part of the referral system that we have within CharityTracker. It's specifically focused in on a particular client. You can then refer to a particular agency. That agency will get an electronic email where it's safe and secure, and going to the agents there within that agency that can help this person. Here's the positive thing too, Mike, knowing that that need has been met as well, you can track that particular set of information. So rest assured, with the hospitals that we're working with, they're able to have cross-sector communication and collaboration within their community, but working from not just the health disparity, but let's get them the food that they need here to fix the health disparity, and let's solve some of these challenges. That's what we're here about, Simon Solutions, Mike. And very honored to, as we're looking at, and I think a lot of people are finding out as to how do we actually fix some of these challenges, we've got to work together and not just with words. Let's put everyone on the same page at the same time. As it happens, CharityTracker is the practical way of doing that. It's taking the words, it's taking that part of what you're doing and putting it into actions. Bringing it all together. Let's make it work. We can do that here. It's exciting to see where we might be able to work from this new challenge. Or this.
Well, what did that guy down in Lake Charles, Louisiana, say about our service?
Well,
Securities and food perspective and food insecurity. What did he say?
Mike, from time to time we get this question, and it's posed from just seeing what we do, and the question is just why isn't everybody using you guys? This gentleman from Lake Charles, Louisiana, Catholic Charities there, he poses a question. He's like, we're talking about all the capabilities that we have working from a community type focus with an agency. And he's just looking at this and he sees it and he's like, Jill, he's like, why isn't everybody using you guys? And my response, I think, Mike, was, I don't know. Maybe you could tell me, because This is the reason that I'm here. I just see this as a way of solving some of the challenges that we have. It's very fundamental, Mike. But getting in as to, we're not just focusing in on the symptom. We could do that all day long and spend hours and hours and hours. Let's focus in on the problems that we're having, the challenges that we're seeing, but let's dive deep. Let's get past what we see as a symptom. And let's dive into what's actually going on. And when you really do that, you see that the reason that the person is in the line getting food assistance many times, they don't have a job or they don't have a living wage. They may have a job. They may have 2 or 3 jobs and they still can't make ends meet. So when you really dive into these issues, now you see where and why we have some of the challenges that we have. We're all about getting a person from a place of crisis to a place of self-sustainability. That requires getting past the symptoms. That requires asking them why they're in the line. What can we do to help you? Is it a job that you need? What you really need is job training. Well, let's get you the help that you need, the instruction. Let's get you some tuition, books. Let's get you the kind of training from a time perspective, an investment in a local college that may be able to help you with this. This is where we really are able to dive in and solve some of these challenges. This is candid, Mike. I mean, we're not trying to sell our product here at CharityTracker. We just see it as that we're addressing some of the challenges that we have in our country and how we solve that. And as it happens, CharityTracker can help you with your processes and being able to track your specific data and information regarding it. That's it. So
that's it. And if you really want to dig deep into the social determinants of health, then you're going to need a solution that will allow you to advance a more comprehensive approach to transforming people's lives. That's when you get into the thing that you often say, we track transformation rather than tragedy. And I like that.
What's the focus, Mike? It's the how our development continues here at Summit Solutions. You know, we could tell you all day long there's all kinds of health disparities. We could tell you the food insecurity is at an all-time high. Okay, thanks for the confirmation. What are we going to do to solve this? We can confirm that there's tragedy, but what are we as a group here of developers known as Summit Solutions, as you out there in the agencies that are working, as those of you that are citizens of the community, what are you going to do to fix that? And we see it as our responsibilities here, knowing what we know, taking innovation and technology to the levels of where we know that collection of data is one aspect of this. What are we going to do with this data, and how are we going to work from a feature perspective to actually set goals, to assess the status of a client, to be able to get them out of it? This is where we separate the men from the boys, so to speak, right? It's one thing to talk about it, but what are you doing about it? And for those of you that are there in the trenches, and you know who I'm talking about right now, you guys are in there and you're working from that perspective of transformation. The chronic tragedies that's going on will continue years from now if we don't do something about it. So this is what we're all about, giving you the tools, the capabilities of transforming people's lives and being able to get them out of that place of crisis to a place of transformation. Abundant living, you say it, Mike, all the time. Abundant living, that's the goal. And that's what everybody should have. And that's where we are here, and that's where our hearts are. We'll continue to work on that. But this is, I think, Mike, what we're seeing is that you don't really have a choice. If we are really going to start solving some of these challenges in our country, we've got to start thinking about measuring. We've got to start thinking about collecting data and then being able to assess that data as to what we can do with that, and not just focusing on confirming that we have issues. Let's fix these issues and let's do something about it. Let's put our money where our mouth is, right? Or let's put those words into actions. Hey, for all of you out there, we appreciate so much. You can always get in touch with Mike and me, Mike at SimonSolutions.com, Joey at SimonSolutions.com. For all of us here at Summit Solutions, a big salute to all of you out there that are working hard, focused in on transformation of people's precious souls. For all of us, take care, everybody. Have a great weekend.